Hello, Dr. Sepp. How are you, darling?
Hello, Trinny. Great to be with you, and thank you for dressing up for me. This is
I
unexpected,
know
but
it's
a
like I
nice
felt
add-on.
embarrassed that I had, but I was just doing a filming for something else, and I was running a bit late. As I'm sorry, we started a bit late, but I thought, oh well, I'll keep it on because it's Dr. Sepp. So
That
we
is too kind.
had our first conversation. I was reminding the audience last week, those of the people who followed it live, and then we did do an edited version last night, which went up. I don't know if you saw
Yep.
that on our main feed. So it gave you a sense of what we felt were the bits, that we mainly had discussed. So where do we go from here? So should we recap on where we're at in this journey?
I
Perhaps you'd
think
like
this
to
is.
recap, and
Mhm.
then without repeating it too much, and then where do we, we're on this journey now. Where else should we be looking? What should we be doing?
Thank you very much for the introduction, and of course, thank you, a big thank you. I'm grateful that I'm allowed to speak to your friends and followers about a topic that I think is very important, not only from a personal point of view, but also from a medical point of view, as it is all
Yeah,
about fighting inflammation.
yeah,
People are so eager to find out the perfect food for themselves to feel fantastic
yeah,
and active and energetic, so that they start to underestimate dramatically of how much more it is important to be able to process what we consume and to
yeah,
afterwards transform it into something that is beneficial for us. We are more and more covering us in fantastic things when it comes
hmm
to food. At
yeah,
the same time, we feel massively undernourished, unsatisfied of how it is affecting our body. That is
yeah,
starting with the look of my skin, for example. It can be affecting my night sleep, the way of how I wake in the morning, feeling activated or regenerated or not. And
yeah,
also is affecting very often my emotional and my cognitive ability to focus, to be vital, to be fluid. Yeah.
yeah. So you said at the beginning there the difference between, we spoke earlier about intuitively understanding what's good for your body and kind of listening when you eat
Hmm.
something and you have a bloat later on or something, your body is kind of telling you this isn't great.
Hmm.
And then we have, on the other hand, great sort of not faddish, but people saying eat a protein only diet to lose weight. And this is not about weight loss, this is about well life. But I'm going to pick up on something which I have another lovely expert who
Hmm.
Julia Hunter, and she is adamant we should eat for our blood type.
Hmm.
And I want to be controversial here. I don't want to do one of you off against the other, but because that was the last conversation I had of a kind of, health conversation,
Hmm.
and you share a lot of the same principles, but it's that thing, how do you work out which foods are good for you? So it's not just avoid the ones that don't affect you. How do you go after the ones that really are going to benefit you?
First of all, there are two big differences. How can I stay healthy, and how do I heal myself from a state of inflammation or disease? Yeah,
Okay.
those are
Yeah.
two different things. I can use
Yeah.
my food, of course, to be a healing factor. It can be my medicine as well. But
Yeah.
again, this needs to be in balance and permanently keeping in consideration that I must be able to transform my food into something beneficial for myself. That means it requires to be as complex as my digestion capacity is allowing it to be processed afterwards. In other
Okay.
words, if I take the most fantastic turmeric, for example,
Yeah.
curcumin is a fantastic remedy.
Yeah.
It's anti-inflammatory, it's antimicrobial. It is helping beautifully if someone is suffering from pain issues of the joints, etc. But if I treat someone who is suffering from an intestinal overgrowth or pollution in the intestine, this person will not be able to absorb it. And the opposite can happen. And the body is starting to invest a lot of its stored and stocked water and hydration to dilute what is sitting inside of the intestine and irritating it. But when it comes to diagnosis, we are using in VIVAMAYR a fusion of traditional European medicine, of traditional Ayurvedic philosophy and Chinese medicine, and pick out there the diagnostic tools that we have to find out what kind of type, what kind of personality is the client
Yeah.
having that is sitting in front of me. We are therefore touching the skin, smelling the body, for
Everything.
example,
It's
the
very
odor.
personalized.
Yeah,
Yeah.
that
So
is
it's
one thing.
difficult. I appreciate, Dr. Sepp, to be generic because everyone is individual, and just for everyone to know, I had a little session with you, Dr. Sepp, a few days ago, and you said to me, I said, I have slightly smelly poo, and you said, does it smell of old nicotine? I mean, it's like, I understand when things get that personal, that you are like a wine connoisseur of poo. I'm just going to put it out there. I found it really interesting that the way, like, how do you, not being with a patient, work out what's going on inside their body? And I found it so interesting to see what kind of gases make the smells that I come out of my body. That's fascinating to me. And I think that, some women would really love to know generally what they can do. When we did your post last night, quite a few people said, I've been to VIVAMAYR, I love it, it's changed my life. So,
Right.
I know that when I get out of staying safely at home, it will be on my top list to go to. I mean, seriously. But what I'd love to do before we go on to the next detail is just do 3 or 4 questions that have come up so people don't feel they're being left behind in the conversation.
If you allow me just maybe to mention one thing, you mentioned the protein. That protein and a very high in protein diet is very good for people to lose weight. That is correct very
Yeah.
often. But
Yeah.
we do know from the animal trials, but also from observation with human beings, that a diet that is rich in proteins but lower in carbohydrate is not leading to more longevity, and is also not leading to a lower rate of cardiovascular events. The opposite is the case. They are, of
Yeah.
course, thinner, that is correct, but if you compare that to a population that is consuming more carbohydrates and less of protein, this is a population that is maybe gaining a little bit of weight, but they live longer and they are
Okay.
more healthy. And I think we are living in very interesting times. People get so much of their information through magazines, through calls, etc. And weight loss is always a top indicator,
Yeah.
or seems to be a top indicator, if something is healthy or not.
I know,
And
and they shouldn't always be
yeah,
that type of connection. Okay, I'm going to do quick fire questions. We've covered some of these before.
mm,
Does apple cider vinegar really help bloating?
it is increasing the acid production inside of your stomach. And if you
Yep.
use it in small quantities as an attractor for the stomach acid production, at the beginning of a meal, you can use it as an additive. It is strengthen your digestion fire, and that is
Okay, great.
great.
Fantastic. Strengthen your digestion. Fire! We want our fire to be burning. Lady, is gut health proven to assist with arthritis? I am fasting and it seems to work.
Our immune system is in charge to either repair or to defend. Yeah.
Okay.
And most of our immune competent cells are sitting in the intestine. So if 3/4 of your immune system sitting in the intestine is experiencing nothing new to come from outside, so no reason to defend, it can beautifully invest its energy into repair and regeneration. And
Yeah.
that is exactly what we want. If there's
Yeah.
either an injury or a chronic inflammation in the joints.
Then, yeah, you want to give a chance. Again, a question we ask so often, but it's so crazy that people still ask, but I appreciate it's just because people. So Andrea's saying, do you recommend taking probiotics?
Uh, Not generally. I do believe it's more important that you feed your bacteria inside of your intestine in a better way. That means to allow your food to have the better prebiotics, better bacteria food inside. This is
So
also the
I
reason.
think that I think some people, when they say probiotic,
Mhm.
they might mean prebiotic. Do you know what I mean? I think they hear
Okay.
this word and they say probiotics.
So
So can we just
probiotic,
define out what would be very
probiotic.
nice is to define the difference for us. Thank you.
A probiotic means it is a substance containing bacteria that are important for my intestinal health.
Yeah.
A prebiotic is a substance that is feeding either a certain strain of bacteria inside of my intestine or generally supporting the
Microbiome.
biome and the diversity inside of the intestine. If I take a medication or if I live a special diet or a lifestyle, I change and alter the diversity of my bacteria inside of my intestine. If you, for example, are eating a lot of proteins, you will have a lot of protein-loving bacteria inside of your intestine, and suddenly your poo will smell like a rotten egg. For example, yeah, if you overdo it
Does anyone
with the
identify
proteins.
with that one? Are you eating a lot of meat? Poo, rotten eggs. Okay.
And the other thing is, of course, if the bacteria inside of your intestine are receiving the perfect composition of food, they are not making you experience bloating, nor do they make nor is the smell of your poo very intensive. We see this with the little children, with the babies.
Yeah.
In the first few months, the poo is smelling innocent.
Yeah.
It is rarely like that, but after VIVAMAYR cleanse, of course, it is again like that.
Innocent poo. If you wish innocent poo, go to VIVAMAYR. Lots of questions, Gabby, here. I have IBS, colitis, and itching skin. Help. That's a general cry for help. And also, is chronic acne related to gut health, or is it an irregular cycle more like the culprit? So can we just talk about a little bit, we've done this with Julia Hunter, but your view on healthy gut and skin conditions. And, you know, I think that IB and colitis is slightly different, but itchy skin, acne, you know, a lot of people think, is it my hormone? Sorry, my phone is having a trouble today. Is it what I'm eating? So I don't, if you would like to expand on that.
Okay. Skin and gut are directly connected with each other, because you have to think everything that your skin needs to look brilliant and to look vital and to glow, it is receiving from the gut. If the gut is performing well and absorbing beautiful things, it goes in like that, and the skin appears to be great. If the gut is polluted, if the gut is having a hard time with either the wrong bacteria sitting on top, or with a lot of intoxication going on there, or just with toxic stuff that I was consuming, partying out a little bit too much, it is also entering my blood circulation and is then facing it is then affecting my body and also my skin. And my skin, and we must not underestimate that, is an outlet, is a ventile for toxins. So if the skin is just surface, it looks nice. If it is a detoxification outlet, okay, I must not be surprised if there's a boiling red spot, for example, suddenly appearing there.
Lots of people asking, is this or that related to gut health? I'm going to throw some at you. Just for mouth ulcers, are they related to gut health?
The gastrointestinal system is starting here and ending at your anus. So it is. So what is, yes.
So if you're getting them quite a lot, what could it be that you're eating that you should stop? Could you be that specific, or is it difficult?
Just a little therapeutic tip, maybe right away. If someone is suffering from mouth ulcer or also gingivitis, that means an inflammation of the mucosal skin inside of your mouth, please start to use oil pulling. That is
oil
very good. Pulling. You are taking 1 good teaspoon or maybe tablespoon of a high quality cold pressed oil.
Like an olive oil?
Like an olive oil is pretty tough from its flavor. You can also have coconut oil or almond oil or whatever oil that is of vegetarian base. And keep it inside of your mouth for 10 minutes, 5 to 10 minutes, and then spit it out again. Do that either before or after brushing your teeth. That is important. Then also, don't use disinfective substances inside of your mouth. If you have a problem with a bacterial infection, use salty water. High concentrated salt water is a fantastic outbalancing disinfective substance, and is not killing all the bacteria inside of you.
Whereas the other one might kill everything.
It is not killing everything, but we are always swallowing a little bit of that. And the bacteria are finding their way from this direction into our system and not from the other way into our system. So,
all right, that's good. That's a nice override. I like the simplicity of going to your kitchen. You can find a solution in your kitchen. I think that's great. This is a bigger question, which is depression and insomnia, are they gut-related conditions? Now, we know nothing about this person or age or anything,
Mhm.
But I'm really interested to know your feeling on, because there are many reasons of why people could be depressed,
Yeah,
okay, and not sleep. But in your opinion, have these ever been things you've dealt with in the gut?
absolutely, 100% yes. It is, and I agree, not every, so each depression is having its own development, its own history, yeah,
Yeah,
its own roots. But in most cases, and I would say in more than 90% of the cases, it is directly related to an inflammatory process inside of the body. And beside the fact, of course, that the satisfying bowel movement and defecation is making us feel happy, all of us, I
yeah,
have no doubt,
yeah,
it is also showing that the intestine is in a good state. If the intestine is in a good state, again, the skin inside does not need to be a barrier. It can also be an entrance for nutrition. And
yeah.
those intestinal cells are at the same time the producers of serotonin. Serotonin is the hormone that
Is
is
your
making
happy
you
hormone?
happy. And this
Yeah.
serotonin, so they are producing more than 80% of the serotonin inside of the body. Some would also say up to 97%.
It's
So
produced
that's
in the gut.
in by the gut cells.
My
And
God.
again,
My
if I
God.
consume too much of something and the bacteria are partying inside and
Yeah.
fermentation is aggressively affecting my intestinal skin, those cells are stopping the serotonin production and I suffer from a serotonin deficiency. And serotonin is important because it's not only making me happy, it's not only responsible for making my gut move. The peristaltic movement is something that is related to the serotonin
Yeah.
appearance. Serotonin is transformed with the help of magnesium into melatonin. And
So,
melatonin is
sleep.
making me sleep, is
Yeah.
making me regenerate, and is one of the strongest antioxidants that we know.
I mean,
Mm,
I had no idea that how much the serotonin was made in our gut. I find that so interesting. I hope, Juhisin, that helps you. Obviously, if somebody is suffering from depression, there are many reasons you could be. So it could easily be clinical, it could be environmental, it could be gut related. So it's one thing to consider if you haven't yet found a solution. Would you consider really cleaning your gut to give an opportunity for serotonin development?
yeah. If you allow me to be controversial, it's not
Yeah.
one thing you could do, it is the thing you should start with. Yeah,
Yeah, I know.
because
I mean, I
we.
want to say that myself too. I feel
Mm,
for some people listening, it's very new, some of what you're saying.
mm,
So when they've gone perhaps from a GP with a very narrow view, giving
mm.
you an antidepressant, and you're coming along saying, hey, your happy hormones are made in your gut, and your gut, if it's screwed up, you have no happy hormones.
Yeah,
This is a
if
big thing for people to hear.
yeah, if you are in an acute state of depression, this is an emergency situation with a very high risk for a lethal outcome. Then, in the end,
Yeah.
an acute depression is nothing the patient can fight. Yeah, this is a
Yeah,
situation where the
it's
patient needs
overwhelming.
help.
Yeah.
Yeah, and
Yeah.
there I'm very happy that we have the pharmaceutical industry. But if I'm feeling not as happy as I was always feeling, if life is not as colorful, if I'm not so interested and everything is flat, please, people, think of your gut and start with
Yeah.
that.
So, on that basis, we're going to keep going back to, so I want to get a few more questions, Dr. Sepp, that might be ones we've missed,
Mm,
but then I'd really like to go into, we need to understand what's toxic, which we really shouldn't go near. What are the most dangerous foods for the gut, and what are the most feeding foods for the gut? And I just want you to think about, I know you're going to know that like the back of your hand, but things like how important is gut health in relation to eczema? I'd say every skin condition comes back
mm.
to the gut.
Psoriasis, neurodermitis, all of those things. Yes.
Yeah. Do you think that when you are a woman and you get postmenopausal,
Hmm.
and a lot of women talk about putting on weight in the menopause and they come out and they just feel tired and heavy, I
Hmm.
think there's so many, like a big bad circle of things that go in a circle. Like you feel low, so you eat. The foods you're eating are not good for your gut. It makes you feel lower. You're producing less serotonin. And it's like
Mm.
that, isn't it?
Fact is that the more experience we grow, if you allow me to name it like that, the more slower are organs working and performing. It's
Yeah.
not only my saliva gland that is then producing less of saliva, it's also my intestine that is moving less quickly. And during the hormonal change, the progesterone production inside of the body completely disappears or almost completely disappears. And progesterone is very important because it is also, first of all, affecting us anti-inflammatory. That
Yeah.
means inflammation is always causing stress, and stress is the enemy of the gut
Yeah.
or the gut performance.
Yeah.
It is also responsible for, or it is important for a proper movement, peristaltic movement inside of my intestine. That is important not only to produce a bowel movement, it is mainly important because if the intestine as a muscle hose is moving properly, it is
Yeah.
cleaning its surface. And a clean
Okay.
surface is able to be a new entrance for new nutrition.
So
And
it's
if
like on a level of cleaning your skin, don't clean out your pore and you're going to develop spots instead of resurfacing and getting better skin. It's exactly the same inside your body, yeah?
just, yeah, it's
Okay, so there's a few more things here. They're quite specific, so we'll answer a little bit quickly, but I want to get back to the big questions. I'm going to do three more like this. Do you believe that an SCD diet is good for ulcerative colitis and Crohn's disease?
an acidy. So you mean an
No, she's
acid?
saying, do you believe I've lost it now, sorry. Do you believe an SCD, I don't know what that is, SCD diet? I don't know what it is either, so let's
I
leave
have,
it.
well, I
Yeah,
have to apologize. It is if someone is suffering from a chronic inflammatory disease of the intestine,
yeah,
colitis ulcerosa,
or
or Crohn's
Crohn's. Yeah,
disease. It is good to be interested and start to find out and start the process in which you should find out what kind of food are suiting you the best and
yeah,
which are absolutely forbidden for you because that is individual. But it is super important that these persons are focusing also on their emotional and spiritual health. That is
yeah,
very important.
yeah, I
There
agree.
is
Yeah,
always something that there's maybe this pea under the pillow that is not allowing the princess to sleep restfully,
hmm,
that is on long term leading to a state that is of course hereditary triggered, etc., but that is then triggering the state to aggravate and to break out into a full symptomatic chronic inflammatory disease.
yeah. I do believe that because I think that, when people say something is stress related, they sometimes feel not embarrassed by that attachment of the word with it, Dr. Sepp, but they just feel, well, it's not fully medical. So are you saying that when I'm hysterical, my thing, but it's just such a, you know, the whole thing of stress in our life and allowing stress to get to us, to me, does cripple the body. And as I grow older, I really appreciate that and know it. Some nice affirmations here. Laura's saying, since the last live you did with Dr. Sepp, I applied his advice, intermittent fasting, chewing more, and I feel so good, in capital letters.
Thank
And
you
they
very
like the
much.
way you don't sugarcoat things. We will save this, don't worry. Somebody says, to the person that asked the question, read depression, please look for a book called Inflamed Mind that discusses this quite exactly.
Mhm.
Everyone's saying they love you.
Excellent book.
Great. And very nice that other people who've had experiences can then share them. Little one, Ginger, saying, I've had an upset dump for over 3 weeks after a spicy meal. How can that happen when it's something you've always eaten? What's happening there?
I think all of us, we are familiar with the kind of stress resistance we do own. Yeah. And
Mm-hmm.
then we are visiting our family and gathering and coming together for a family meeting. And suddenly all of my stress resistance seems to disappear.
Yeah.
My environment is massively influencing the way of how I'm good in digesting something or not. Yeah.
Mm-hmm.
If I'm super stressed, I can hardly digest a slice of bread. Yeah. Not
Yeah.
to think of digesting a piece of apple properly.
Yeah.
If I'm sitting on the shore of Brighton, for example, and the sun is
Mm-hmm.
warming me, I will be able to also turn a pina colada into something that
That's
is
good for
perfectly
your
soothing me.
gut.
Yes, why
Yeah.
not?
Yeah. So,
Yeah.
so the stress and the way that food is processed due to our stress extent state has a big play. Okay, let's go now, which is the every other question is asking this. I'm sure you're seeing this, you're going through. So what is the best thing to eat to get a clean gut?
The best thing to eat to get a clean gut is the meal that you are able to digest almost 100%. And that means it must be small. It must be easy digestible, and that normally works better with warm foods, with warm meals. And it must not contain very spicy substances. Yeah, you can use herbs, of course, also from a healing perspective, that you add herbs to stimulate the digestion, etc., like the fennel seed. But if you want to feed someone as efficient as possible, think of the food that you offer to the babies. They are just resting, growing, developing beautifully, learning every day a little bit more, and they are getting almost nothing but root vegetables in the beginning. And then you introduce a little bit of potatoes, and then you introduce a little bit of rice, and then comes the chicken. And then, interestingly, when you normally give them the chicken the first time, their poo is losing completely its innocence. And the diaper is turning into the diaper of a human being.
So it is that starting as a way of cleaning it, of really going back to that very uninvasive foods. Well, if people were to do that and they're used to getting their supplements through their food, they might then feel, they're not getting that much. And so what do you suggest at that point?
This is the situation where I want to clean my gut, is the situation where I feel separated and not at my ideal state of health. I feel separated from my health. So I want my diet to be a healing medication or a medication. In this situation, to clean your gut with food that is just making you survive, but at the same time not overnourishing you, and this is the most important, not disturbing you, is allowing you to experience your intestine to be in the healing bandage of a diet that is very boring, of a diet that is very, not very entertaining. But after a few weeks, you can start to increase, of course, the diversity of the diet. You can become more colorful, and you will experience an intestine that is now able to process it in a better way and to nourish yourself. And that is what it is about in the modern Mayr medicine. We clean the intestine using brines. We are cleaning the intestine and nourishing the body by using very simple and easy digestible diets, individually tailored, for allowing the person to rest, to repair, to regenerate, but definitely not to defend.
There's been a big fad for bone broths and things, Dr. Sepp, and somebody here, Stephanie, is saying meat is one of the best things to heal an inflamed gut. That statement in itself, to me, I'm like, But then she goes on saying bone broths are very important. So where do you stand on meat, considering if one isn't a vegetarian, but, because on this O-type thing, some people really suit meat and some people don't, The idea that you clean your gut with meat, to me, sounds weird. But tell me your view on it.
We are also asking all of our clients for their blood type, to name us this blood type. This is one aspect of to get a holistic idea of who is sitting in front of me. This is important and interesting. But it is much more complex, and I think Julia will agree with that, then everyone is thinking. It is not just blood type O, A, and B, and AB. There is much more behind that. Regarding meat, if meat and eating meat is making you feel fantastically, and everything is smelling good, is feeling good, and you lived a perfect life, and you feel perfectly energized, meat is good for you. I personally do think there might be reasons why someone does not want to reduce the meat intake. And if you are grown up and adult, you don't need meat at all. You need some aspects that you find in meaty or muscular things like vitamin B12. And in case you're living a vegetarian or vegan life, you need to compensate that by consuming an extra amount of algae, for example, to to get this vitamin B12. But meat, from my perspective, is a superfood. Small quantity is great.
Yeah.
A little bit too much, and it turns into a horror show. It turns my intestine into a battlefield.
Yeah.
Bone broth is nice,
Okay.
but you are
Like
with
a
the
big juicy steak, and me, we don't get on, even though I'm O-type, and I think I should. But just for people who have joined, we are with Dr. Sepp, who is the Director of Medicine at the VIVAMAYR Clinic, where they specialize in cleaning out your gut and believing that many things we suffer from start in the gut. So if we can have a really good gut life and gut health, we can actually begin to heal elements of our body. So we're discussing in detail some questions now from the audience, but also just continuing the conversation of what are these foods if you wanted to do this kind of, staying safely at home, and Dr. Sepp can't take your blood and smell your poo. How can you begin on this process? We discussed in part 1, which is on the feed from yesterday, the concept of intermittent fasting, which is to, have your last meal at 7 in the evening, and then for 14 hours or 16 hours, you do not eat again. So it would mean that, you wait till 12 o'clock to eat. So you give your body a few days a week that break in order to really focus on repealing and healing and repealing itself. So we talked a lot about that in part 1. So now we're kind of going more into, should we be doing blood type? What foods should we be avoiding? How do we listen to our body? There's also a lot of work around at the moment on alkaline diets. And I know for myself that when I eat really acidic things, my pee is more acidic. I feel that acidity, So how do you feel about the level of alkalizing? We've got all these, not fads, we've got all these, the blood type, the alkalizing, the bone broth,
For example, bone broth is super acid until you then, in the end, add the root vegetables to it. It is, for example, a beef is much more acid than pork is, or fish is. Yeah. Fish is more acid than than pork is. There is a state of, or the grade of acidity in our food is relevant, but not as relevant as the state of acidity in my lifestyle is. My life, and the more I live and the more intense I live, the more acid it is, and the more it is important to have then an alkaline break in form of the rest of the sleep. When I'm sleeping, I'm stopping activity, and this is allowing my system to get back into the homeostasis. Yeah, this
which
balance.
might be why I can eat exotic fruits when I'm on holiday relaxed, but I can't go into M&S and pick up some mango and pineapple because I bloat.
Yes, this is why I mentioned the pina colada on Brighton.
Yes. Also, people ask a lot about coffee, and I know we discussed it briefly, but Booth Cockapoo, one of our lovely, joyful followers, says, what do you feel about coffee? Is it good or bad for you? I know we talked about sneaking in a little coffee every day, but what are your thoughts?
Some of us to benefit a lot from coffee. Some of us to really experience, for example, a reduction in risk of developing breast cancer. This is related to the genetic determined performance of my liver enzymes, and you can test for that. Caffeine is an aspect inside of the coffee that is more problematic. The bitterness, the bitter taste and flavor inside of the coffee is something, if you use it as an attractor, it can stimulate beautifully your digestion. It is increasing the bile liquid flow out of your liver and your gallbladder. It is also stimulating the stomach to exit, to close. So it is like a preparation for digestion. And that is very important and can be used very beautifully. There is on the other side a reason why we found out, and that is pretty common sense in our real life in our real life, that we don't give coffee and alcohol to little children. Why is this?
We don't give coffee and alcohol to little children because it overstimulates. It overstimulates them.
Exactly. We want them to develop to the possible best.
Yeah.
And alcohol and coffee is not necessarily useful for that. The same
best,
thing, of course, with the cigarettes and smoking.
Yeah. My daughter's taken my charger, so I have 1 or 2 more minutes only. I've just seen that, I'm sorry to say. But I just want to do some burning desires on, like, matcha oat drinks. What do we think about them? You know, that's a little kind of thing. Sucking on bone broth. Could we hear Dr. Sepp's thoughts on marine collagen?
Mhm. It is marine collagen is a nice thing. I prefer the collagen that you normally find in the classic bone broth. You can also make bone broth out of mushrooms, for example, and other roots,
Yeah.
because you need the collagen inside to be completely and perfectly stretched to afterwards be absorbable inside of your intestine.
Yeah.
We do not 100% know and understand why collagen is entering the bloodstream and blood circulation, but it does. Theoretically, it is just too big and must not be absorbable. But
Yeah.
we do know the more stretched it was, the moment we consume it,
Yeah.
and this is what you find in a broth or in a soup,
It's
much
been
more than a
stretched.
powder.
Yeah.
Yeah.
So there's a little thing here which I know my view on it, but a lot of women say, oh, these lovely collagen drinks for skin and the collagen supplements and everything. What are your thoughts?
Most of us, we don't suffer from too little, but from too much.
I know, but
Yeah.
if you speak to a woman in a vanity perspective, not in intestinal digestion, we need collagen or we have too much, they would say, oh, I've lost the collagen. So,
You
you know,
know,
when they see a pill in the departments, you know, health food store, collagen for good skin, I mean, do you believe it can even get to your epidermis?
we know that it is reaching again the blood circulation. I do believe that as a woman that is wants to have a very elastic skin, for example, does require or does benefit much more from base powder or something alkaline than from collagen.
What's
Yeah.
base powder?
Base powder is just a combination of alkaline salts that are helping your body to de-acid into the intestine, allowing your blood to be more neutral
Yeah.
and allowing then your blood to detox the acidity from the skin, from the soft tissue that is normally
Okay.
meant to nourish your skin,
Yeah.
detox into the blood and get rid of it then through the kidneys or through the gut.
Okay, so would that mean if I take a magnesium bath, would that be helping that?
It is pulling then, of course, or helping your body not to detox into the blood, but
Yeah.
detox out of the skin. That means your skin is then turned into an ventile, into an outlet. And again, it can react immediately with a sudden redness. It can also you can also experience there an irritation, like an itchiness. Worst case, even a pigmentation. But the body overall would appreciate it, of
Okay.
course. And skin is skin.
Skin is skin. I have something this big, magnesium salt. It's been such a pleasure, Dr. Sepp. I mean, I would like that once a week we chat, because I think everyone would ask you 101 questions. I know you're really busy, but I'd love to just get one more in where we could think, and you might think on the journey that our ladies are going on and boys are going on with you, where should we go next? So do you want to have a think about, you know, we've got them to here. Okay, now where should we take them?
It's maybe of the basic columns of health. Yeah, we talked a lot about the intestine. We talked a lot about food right now and different ingredients. Maybe that we together discuss of what I mentioned today, the spiritual or emotional health that is important, that we bring a few things together and how to value them maybe.
Great, that sounds great. Because we talked a lot here about stress and it's that side of things perhaps a bit, Fantastic, Dr. Sepp, thank you so much. And
thank you,
I
Trinny.
look forward to our next session. Okay.
Me too.
Right.
Thank you very much.
Okay.
Bye-bye.
Bye-bye.